C-section scar desensitization and mobilization is one of the most important things that you can do after having a C-section. This is not talked about enough, and I'd say that 99% of women that have had a C-section were not educated on this from their OB. A C-section is a major abdominal surgery. To get to your baby, your doctor had to cut through skin, then fat, then fascia, then your abdominal muscles, then the peritoneum, which is the lining of the abdomen, then the uterus, and finally the amniotic sac. With all of these incisions made, it's very common to have nerve issues like numbness or tingling or hypersensitivity, meaning that when you touch the scar or the area around the scar, it kind of makes you jump and feels like a shock or something similar. Because of the scar tissue that results from having all of these incisions, it's very common to have bladder-related issues like bladder pain, increased urgency, or leaking. I also commonly see tense or tight pelvic floor muscles because your pelvic floor is so connected to your lower abdomen, resulting in pain with sex and leaking. You might also notice that when you do resume exercising, it can be very difficult to connect to your lower abs and to turn on these muscles when you're doing core work. All of this is so common, and why doing scar work is so important. Scar desensitization refers to the techniques aimed at reducing those nerve-related issues like sensitivity, pain, and numbness. This can really be done as early as day 1 because it does not involve us trying to move the scar or the skin surrounding the scar. My clients have told me that just this one piece of information that I'm going to share with you has significantly helped to heal their scar and their lower abdomen. And that is, from day 1, I want you to visually connect with your scar. When you're doing scar work that I'll describe in a moment, I want you to look in front of a mirror while you're doing it, whether you're standing, seated, or laying down. The more you can look at and connect with this area, the more it's going to start to integrate with the rest of your abdominal area and not be this foreign part of your body. For many women that have had C-sections, it was maybe something that you weren't planning on happening, and could be a really traumatic experience. With that, I find that many women just want to avoid looking at, touching, and connecting with their scar. And I recognize that healing from an unplanned C-section can be both a physically demanding process and an emotionally demanding process. If you're really struggling with this, I recommend talking to a postpartum mental health therapist, and just that can make a world of difference. Okay, so you're in front of a mirror, looking at your scar, and from there, you're just gonna take your clean finger and start to make some small, very gentle, circular motions on the skin about an inch above the scar and below the scar. And I just want you to be curious about your body right now. What sensations do you notice? Does one spot feel different than another? Try feeling further away from the scar and notice what that area feels like compared to the skin closer to the scar. We will avoid touching the scar directly until it's healed and you've gotten the okay from your doctor to start touching your scar. After noticing what your finger feels like, grab a different texture like a hand towel and do the same thing. Notice what that area feels like. And what we're trying to do with this is tell our brain, okay, here's what normal feels like, and here's what it currently feels like as you're rubbing that skin closer to the scar. This is why doing this in front of a mirror is so important. Also, when you're doing this, try to relax your body as much as possible. Find whatever position is going to be the most comfortable and take some slow, deep belly breaths. I find that laying on the back is most helpful with a hand mirror in one hand while the other hand is doing the work. Now, once you've gotten the okay from your doctor, you can begin doing the same thing, now touching the scar directly. Work your way up to a texture like Velcro or something that is very scratchy. Know that nerves heal very slowly. The rate of nerve regeneration is typically estimated to be about 1 to 2 millimeters per day or around 1 inch per month. However, this rate can really vary. So it may take a long time for this area to feel normal again. Again, scar desensitization is something that you can do from day 1 all the way up until a couple years later. If you had a C-section and you're maybe even a few months or even a few years postpartum, it's not too late to start doing this. Now that we've covered scar desensitization, let's talk about scar mobilization. This involves techniques aimed at mobilizing or moving the skin and the underlying fascia that was affected from the incision. The most gentle way to do this is simply through doing belly breaths. When you inhale, this area expands and stretches, and when you exhale, it comes back to its neutral resting position. And that is something that you can do from day one after you've had a C-section. Things like skin grabbing or S-curves or pinching are things that we're gonna wait to do until your 6-week checkup with your OB and they've given you the clear to do so. So if you are 6 weeks postpartum or more, you can begin to do these things that I'll describe now. So you've already been doing your deep belly breathing, and we're gonna add an additional component to this. So you're gonna take your hand and place it just about an inch above the scar. Now you're gonna inhale into your hand, and on the exhale, you're gonna pull up. Maintain that pull, take another inhale, and then on another exhale, pull up even more. Maintain that, and you're gonna do that for a total of 3 breaths, and then come back to neutral. On your next inhale, move your hand to the right, and repeat that same cycle of 3 breaths, then do that to the left, and then do that to the hand below the scar and pull down. And all we're trying to do is just move this area a bit more. This is what I always start with. The next thing you're gonna do is similar to what I described in the scar desensitization, where you're taking your 2 fingers and rubbing along the scar. Except this time, it's gonna be a bit more firm. This time you're actually going to try moving the skin and the fascia with your fingers as opposed to just rubbing gently on top of it. And you'll do this above the scar, below the scar, and right on top of the scar. And this should not be painful in any way. And just like with the desensitization, you're going to do this in front of a mirror. The next thing is S-curves and pinching. With the S-curves, we're going to make an S shape as we move along the scar. So my top finger is pulling down while my bottom finger is pulling up. And then you're gonna do that in the reverse way along the scar. Now with the pinching, we're actually going to be pinching the scar and the skin surrounding the scar and trying to pull up. The goal with both of these is to get more movement in and break apart some of that scar tissue and get more blood flow to the area. Another thing that my clients love when I use on them is a myofascial cup. This one is a little different than the one that I want you to get, and I'll insert a picture of what that should look like. But you can buy this on Amazon for like 10 bucks, and I think it's a wonderful tool to have. What you're gonna do is put some coconut oil or any kind of oil or lotion around the scar, and then you're gonna pinch the cup and place it on the skin to grab the skin. And then you can move the cup around the scar. Do this laying down, as it's gonna be difficult to do if you're seated or standing. And this is a great way to mobilize the skin and the fascia and to get more blood flow to the area. And the last thing that I'll give you are stretches that you can do to mobilize. All of these stretches are going to help move the skin, move the fascia in a gentle way. Go slow and use your breath when you're doing this. Wait until you are 6 weeks postpartum or more to start doing these exercises and stretches. Okay, that was a lot of information, but I hope that was helpful. Remember that a C-section is a major abdominal surgery, and as with any surgery, rehab and rest are important. Be sure to watch my video on pelvic floor stretches and pelvic floor breathing next to ensure that your pelvic floor muscles are recovering as well. Let me know if you have any questions, and I will see you in the next one.